And I will strongly encourage all faculty with talents in research to really make mentoring a primary focus.
One of the most important things is to identify a mentor, especially when you are junior and learning that landscape. I think you can read all the books about how to be a clinical trialist, but there's nothing like the real world experience, and that's something that's difficult to jump into alone. And so when you're identifying a mentor, finding someone with really strong experience in the diseases that you're looking at, but also just in what it means to be a clinical trialist, I think is probably the most important thing.
Yeah, and I think it's the curiosity. I think that sometimes I hear young faculty or residents or fellows say, well, I'm not interested in research. I'm not interested in clinical trial. But then when you push them a little bit more, they've never been exposed. They don't know what they're not liking because they don't know. So it goes back to that curiosity and that opportunity.
Yeah, I would say that as I did my medical school training here. I was a resident here, so I really grew up here in the academic sense. And early on, I identified Emma as somebody who I wanted to emulate in terms of an academic career, both in the research setting, and then I saw her in clinic interacting with babies. And the way that our program is built, we didn't necessarily always get assigned a lot of time with Emma, and so I kind of had to stalk her a little bit. And I showed up, I popped in any time I could, and that's kind of really how I got my foot into that door.
Yeah, well, she made the first move, showing interest, and she was very proactive, and that's what I think is the best mentee. They're always the one proactive. They say curiosity, right? That's all science and research is about, curiosity. And clearly, Bo was full of curiosity and very proactively. I remember as a young resident, she said, why don't we start doing cases? Let's meet every other week and do cases for pediatric neuromuscular, interesting cases.
And the other thing you want in a mentor is actually someone who's going to sponsor you. And so I had this certainly where as I was being integrated into learning about clinical trials, at some point you got to spread your wings and become the main primary investigator, and you have to be given that opportunity sometimes. And so I had the sponsorship, certainly of Dr. Ciafaloni and others, to be able to start that process too, and hopefully bring that to the next sort of generation of
pay
trainees,
forward.
right?
And I think that one of my most rewarding things in the past few years is when I decided, okay, this team is ready, I'm going on a sabbatical. And the team did awesome. And I will strongly encourage all faculty with talents in research to really make mentoring a primary focus, because this is our legacy as an institution and also as a person, as a human being. What are you going to leave behind, right? And so it's such a rewarding endeavor. And I think that especially in clinical trials, like Bo said, there are not things that you can learn from a book necessarily, is that experience. And so share it with your mentees. It's really not about you, it's about them and what you're gonna leave after you're done. And to me, that's one of the most rewarding thing I feel in my career.